Hi y'all! So I'm doing my project on the WILMS tumor. I know we did the WILMS tumor in class and I found it really exciting and I wanted more information about it so I could be more educated, and hopefully this video can educate my classmates on it as well. Well, the WILMS tumor is also called the nephroblastoma. Hopefully I said that correctly. If not, I know Miss Hannah Banana will correct me after the video. But anyways, the WILMS tumor is located in the kidneys. Well, it can also be, it's mainly unilateral, meaning it's only in one kidney. But 5 to 10% it can be bilateral, meaning in both kidneys. And this is one of the most common tumors in the kidney for young children today. So how do we know if a young child has a WILMS tumor? Well, the first step in diagnosing a WILMS tumor, or how to handle the proper way of documenting a WILMS tumor, is first thing having a physical exam by your doctor. Your doctor will have a physical exam and he will see if you have any symptoms or signs of a WILMS tumor. Once he figures out you have a sign or a symptom of a WILMS tumor, you will have a blood and urine exam, and that won't detect that the kid has a WILMS tumor, but obviously a WILMS tumor is in the kidney. So if there's anything wrong with the kidney, the urine test can uncover problems of a kidneys, anything with the kidney, with the urine. You understand what I'm saying. But anyways, once they have that test and figure out, yes, there is something wrong with the kidneys, that's when the sonographers come in place and they will have a ultrasound, and the sonographer will document and take the pictures of the WILMS tumor and send it back and let the doctor handle it from there. So scanning a child with a WILMS tumor, you want to keep the patient calm and easy. Along with that, you gotta keep the parents calm and easy as well, because it is the most common tumor in young children. So when they're gonna come get scanned, of course the parent is going to be with them. So you need to keep eye contact, have a soft voice while you're talking to the child, keep the parents and the child updated on what you're doing, and if the child is uneasy, you need to make them ease. If they don't know what the transducer is, tell them it's a little machine that takes pictures of their insides. Might be a little creepy saying insides. Don't know. I will ask Alicia. But anyways, if they're a little scared of the gel, put the gel in your hand, put them on their hands, let them feel the gel, feel it's warm. Instead of going into a dark room, dim lights, have the lights on before you bring them in so they don't feel scared like they're going in a dark closet with monsters. We're not doing that. And then sometimes, if it makes it easier, let the parent hold the child while you scan, and let the parent help keep them busy. So, strategies to diagnose a WILMS tumor. A WILMS tumor has 5 different stages. The first stage of a WILMS tumor is when the tumor is just in one kidney and it's pretty smaller than the other stages. Stage number 2 of the WILMS tumor is when the tumor has grown into like the tissue, the fat, and possibly some blood vessels, but it's still smaller than the others, less severe. Stage 3 is when the tumor has grown into like structures of the abdomen or the lymph nodes near the kidney. And then we have stage 4. Stage 4, it has grown outside the kidney, possibly to the bones, the livers, the lungs, and maybe even the brain, just really, really big. And then stage 5 is probably the worst because it's the WILMS tumor that is bilateral in both kidneys. And I want to say this is probably very, very bad. It's the severe, it's the worst. So you're probably all wondering, what is the treatment for a child that has a WILMS tumor? So once the child gets diagnosed with what stage, then they will go with what treatment. If the child got diagnosed with stage 1 or 2, the whole entire kidney that the tumor is in will be removed because the kid can still survive with one kidney. Stages 3 and 4, they will have to be put on some type of treatment to shrink the WILMS tumor so it can be operable to be removed during surgery. And then for stage 5, since it's in both kidneys, the child will possibly have to go through chemo, radiation treatment, and then possibly surgery to remove the tumors. So for the outcome for children that has the WILMS tumor, for stages 1, 2, and 3, it's 95% to 100% survival rate for a 4-year period. Stages 4 and 5 has a rate of 80% to 100% for the same 4-year survival rate after the tumor has been found. I'm going to upload a chart that I made with the survival rates so y'all can see that. So moving forward in my career as a sonographer, I'd rather have a more expanded educational background knowing the stages of a WILMS tumor, what I'd be looking for when I scan a kid possibly, and just know the treatment and the outcome for it. I know there's different stages, like I said, for a WILMS tumor, but I know especially look for a tumor in the kidney. It can be homogeneous with a complex texture and a large mass. And I know how to document it, write it up, and submit it, I guess I would say. And I feel like it helped me and also y'all just for the future of knowing. If that really makes sense. It makes sense to me, hopefully it makes sense to y'all. I couldn't find any pictures of an ultrasound screen on like Google and stuff or all the stages, but I did find this one picture that really helped me know the difference of stages. So I'm gonna post that at the end of the video along with all my citations and what I use for this video. Yeah, I guess that's about it. I mainly use my citations off the internet. I was trying to look for someone to interview, but that didn't really work out. So yeah, I guess I'll say bye, and I bet you're all looking forward to this. Bye, you mother tuggers!